Welcome to Carrington healthAbility's 2020 annual report. My name is John Rasa, and I'm proud to say that I've been the board chair since June 2018. Carrington healthAbility is committed to working in partnership to enhance the health of our communities, particularly our vulnerable communities. It goes without saying that 2020 has been one of those most unforgettable years in our lifetime. With bushfires and COVID-19, we've experienced crises on many levels: health, environmental, economic, and for many, personal. It's been a testing time, and it's tested everyone's resilience. The Chinese use two brushstrokes to write the word crisis. One brushstroke stands for danger, the other for opportunity. In a crisis, be aware of the danger, but also recognise the opportunity. As a community health organisation operating for over 44 years, we're used to seeking out opportunity in all circumstances and adapting to varying community needs, changing funding models and also government decision making. It's in our culture to respond to situations of exceptional change and transformation. It's also because of this strength that we've been able to play an active and effective role in the health system's response to the pandemic, and even during these times stay true to the strategic vision for people in our community to enjoy better and longer lives. In February this year, we were not providing any services via telehealth, which is both phone and video calls. By the end of April, only a few months later, we were providing 63% of the services by telehealth and 72% by July. Naturally, some services like dental and podiatry are not suitable to virtual delivery and continue to be provided safely in person and within departmental guidelines. We continue to actively protect the health of our staff and clients so we can return to 2021 even stronger. I will now pass over to Ronda, our Chief Executive Officer, to explain.
What a year it turned out to be. By the end of April, 75% of our 330 staff were working from home, and by the end of June, that had increased to 90%. Despite the challenges of managing our response to COVID-19, we have increased our level of service. I'm proud that compared to the same period last year, we've provided an additional 1,300 service contacts. Over 21,600 people received a service from us in the financial year, including almost 1,000 with a disability receiving therapy, in-home or social supports. But in some ways, what we have provided is less important than how we have provided it and the difference we've made in people's lives. In this together is one of the most used phrases this year, but the power of togetherness and partnerships is central to our role in enhancing the health of our communities. It's important in working with our clients and the important people in their lives. It's essential to creating new ways of doing our work, and it's a core reason that we are able to partner with other organisations to deliver the greatest impact. I'm so proud of our team who worked together to adjust how we provided services and supports, and at the same time making sure that we provided a safe environment for everyone. There are so many examples of how staff were able to provide what was needed in such a different way. We had dental technicians who were willing to be seconded to COVID-19 testing clinics. We had all of our clinicians who redesigned their services to be suitable for telehealth and video options. We had exercise CDs that we were able to provide to clients to use at home. We had parent support webinars, and we even provided telehealth to some families who were stranded overseas and unable to return to Australia. I think a really important service that we were able to offer was that every single one of our clinicians called every single one of the clients on our books just to check in, to find out how they were coping, whether they had any needs, and sometimes just to provide a friendly ear. Some went the extra mile and baked cookies and wrote a poem and delivered them to the doorsteps of their favourite older customers. And all of these things have been so important in helping our community to remain feeling connected. And really, at the forefront of that is our in-home and community support service, where our fantastic team go into the homes of older people who would like to stay at home rather than moving into a facility. Of course, during COVID, there was an enormous reliance on safety and care and what we were able to provide for those really valuable customers, and I'm so proud of the team that continued that work. We could not have continued providing what the community needed without our partnerships, and there are many examples of our regional collaborations with GPs, with other social services, with the Primary Health Network, with our hospitals in our region, Eastern Health and the Austin, and with our funders, including the Department of Health and Human Services. One example is the use of our facilities for Eastern Health to provide COVID screening clinics. And there are many other examples. We had staff who were seconded to the public housing towers in the inner suburbs, and in fact, many have not yet returned because the need there is still great. So we've been proud to be part of a response to this unwarranted health challenge, not only in our region, but elsewhere when needed. I'd really like to take this opportunity to provide some thank yous. Firstly, to the chair of our board and the directors on our board who voluntarily give their time to provide the leadership and strategic direction that's so important for any organisation. I can't thank the management team or my staff enough for the effort they have put in to ensuring that we continue to meet community needs despite the current challenges. I'd like to thank our volunteers who haven't been able to participate in the second half of the year as much as they would like to, and who are raring to get back when they can. I'd like to thank our partners and our funders and the broader community support that we've experienced from our local members of parliament, from local government, the leaders in the community and the community members themselves. And I'm also aware that there will be an avalanche of health needs that follow the pandemic, and that we will experience an increase in the number of people and the complexity of those who need our service. And we will continue to focus on helping our older people stay at home longer, those with a chronic condition or disability to live their best lives, integrating supports for children and families, providing dental services, and supporting those with mental health challenges. We hope that you enjoy our first ever digital edition of our annual report.